better than, what's that other stuff called?
Botox.
Oh, Botox.
So yeah, no,
Let's
Xeomin.
get a good.
First of all, I think I like Xeomin because
Feel
it comes in a powdered form.
So that's, here, film the preparation of Xeomin there. So that's originally a powder, so it's more shelf stable.
Very well, yeah, correct. Not only is it shelf stable, but also the mechanism in which it works seems to be a little different than the Botox. And when it's different than the Botox, for those who are getting resistance to the Botox, this is definitely a good option. So I would, I'd highly recommend it. 12. I was gonna go 16 units here, kind of mix it up a little bit. But yeah, no, so I recommend it because I like it a little easier to use. I'm gonna have you lay back on it.
Okay.
So the first spot I really want to get at is the glabellar area. Even though you don't want to focus all of your work on the frontalis because that's where he has the most concern. Can I have you look mean, like upset, and relax? All right, so he doesn't have much of a glabellar area, so what I'm going to really focus on is this area right here. And this area right here.
Wow, there's like no pain to this.
Awesome. That's such a small needle too.
I could hardly feel that. That's great.
Can I have you look up? Okay, and relax. So what I'm going to do is the frontalis muscle is all up in here, so I'm going to try to spread it out to kind of get as much as I can. And I go up on the top areas here to kind of get the most bang for my buck with this.
So what would be like the perfect person to have this done?
I think people who have, for me, it's not so much that these lines, but the perfect person is the one who everything is down. Everything is like just covering their face and they want to lift it up. Ideally for me, I like to have this kind of a look, more of an open, like open your eyes and kind of have like you just woke up kind of, you know, maybe after a refreshing shower or something, how sometimes everything is a little tight, very relaxed.
So I've heard some people report that they get a little bit of migraine relief. Is that true?
True. In fact, we use it for migraines.
Oh, we do?
Mm-hmm. Can you look me? Yeah, perfect. And relax it. So that's it. I really put a little bit more in here because I really want to relax that spot for him. And that's it.
So you want to,
little
Dr.
bit.
Yousef, so like how long is this going to take effect?
It may take up to a week, maybe 2 weeks at the most, but he may even notice results first couple of days, maybe 3 to 4 days.
So 3 to 4 days. So like what will be like the first thing I notice?
You'll feel tightness, a little pulling sensation. You know, for me, when I've given it to patients in the past, the first thing they tell me is, I wake up in the morning and my eyes are not drooping over. You know,
gosh,
they're
that
not.
would be amazing.
You know, like it's like as if they're not having to like wake themselves up. It's almost like it's a lot looser, a lot less work in trying to wake up in the morning. It doesn't have that droopy feel, and of course the lines are there. Everything is pulled back. It's just an amazingly relaxed feel. It's not bad feeling at all.
So what would be the next step? We do this, and then what would you usually recommend after this?
So yeah, I like to take care of the Botox because it's something that we've all been comfortable with for many years. But fillers are really the way to go, in my opinion. You're gonna get the most out of your money when you use a filler. I like to get the cheeks and the nasolabial folds and the lines under the chin. I like to take care of all of that.
Okay.
So, yeah.
Thank you very much.